Dr. Marcus Ellery had always been a name people in Houston spoke with admiration. His clinic, nestled between a row of pharmacies and a small diagnostics lab, had grown from a modest practice into a bustling medical center over the course of 20 years. Patients trusted him, not only for his steady hands and accurate diagnoses, but also for his comforting bedside manner. The kind that made even the most anxious patients believe they were in the safest of hands. His walls were lined with degrees, plaques, and awards from medical associations and community groups. Behind his office desk, a framed photograph of him shaking hands with the city's mayor reminded visitors of his influence. But beneath this carefully curated image, subtle cracks had begun to appear. It started with whispers from former employees about unusual billing codes being entered into the electronic medical record system, codes that didn't match the treatments patients received. At first, no one wanted to believe it. After all, Dr. Ellery had donated generously to local charities, sponsored free health camps, and often waived fees for underprivileged families. Yet the whispers persisted, growing louder each month. A nurse, who had worked with him for over a decade, noticed that certain patients' files had procedures listed that were impossible to have been done during their visits. She quietly mentioned it to a friend at a local insurance company, not knowing that her words would set off a chain reaction that would ultimately dismantle everything Ellery had built. The community saw only his gleaming reputation, but inside the clinic, there was an atmosphere of quiet unease, a sense that something was being hidden, something big. This unease was about to spill out into the open. Insurance companies are used to catching small billing errors, but the anomalies tied to Dr. Ellery's clinic were neither small nor isolated. Analysts flagged an unusual cluster of high-cost procedures being billed multiple times for the same patients within impossibly short timeframes. For example, one patient's record showed 3 separate echocardiograms within a 2-week span, each billed at full cost, something medically unnecessary and statistically improbable. In another case, the system indicated a knee replacement surgery performed on a patient who had only come in for a routine physical. At first, insurers suspected clerical errors or accidental duplications. But when these patterns repeated across dozens of patients, and the dollar amounts ran into the hundreds of thousands, suspicion hardened into concern. The tipping point came when a former billing clerk, Jenna M., anonymously contacted a state health fraud hotline. In her detailed statement, she described internal meetings where Dr. Ellery and senior staff discussed ways to optimize revenue by identifying billable codes that insurance companies rarely questioned. Jenna provided copies of emails and internal memos that explicitly instructed staff to upcode, a practice where a service is billed at a higher rate than what was actually provided. These documents, combined with insurance company reports, painted a troubling picture. Federal investigators from the Office of Inspector General, OIG, were alerted, and an official probe began. What made the case unusual was not just the scale of the fraud, but how openly it seemed to be discussed within the clinic, as if those involved felt untouchable. When the investigation moved from desk analysis to boots-on-the-ground work, the atmosphere inside the clinic changed dramatically. Plainclothes agents began making discreet visits, posing as patients, testing whether the procedures billed matched the care they received. In several cases, they discovered that simple consultations were later recorded as complex, hour-long treatments involving specialized equipment. Surveillance teams tracked financial flows from the clinic's accounts to offshore holdings and shell companies registered under the names of relatives and longtime associates. Search warrants led to the seizure of hard drives, billing records, and even handwritten notes in Dr. Ellery's private office. One particularly damning piece of evidence came from a recovered deleted file, a spreadsheet calculating projected profits from enhanced billing strategies over a 5-year period, showing how small increases per patient could generate millions in additional revenue. Interviews with former staff revealed a culture of intimidation. Employees who questioned billing practices were either reassigned to less critical roles or subtly encouraged to resign. Meanwhile, local news outlets caught wind of the investigation, publishing cautious but increasingly pointed reports. The once celebrated physician now found himself trailed by photographers every time he left his home. Federal prosecutors built their case methodically, knowing that to secure a settlement, or a conviction, they needed irrefutable proof that the overbilling was intentional, not accidental. When charges were formally filed, the courtroom became a theater of tension. Prosecutors presented evidence in painstaking detail, charts comparing actual patient care with inflated billing records, whistleblower testimonies, and financial statements tracing illicit gains. The defense countered with arguments about clerical mistakes, complex insurance coding systems, and the pressures of running a high-volume clinic. But the tide turned when Jenna, the former billing clerk, took the stand. Her calm, precise account of how the fraudulent system operated, including her recollection of meetings where upcoding was explicitly encouraged, resonated with the jury and the public. As trial days turned into weeks, Dr. Ellery's once loyal patient base began to vanish. Local radio stations ran heated debates about ethics in medicine, and community leaders who had once praised him now distanced themselves. Facing mounting legal fees and the risk of a lengthy prison sentence, Ellery agreed to a $2 million settlement without admitting wrongdoing. While the settlement spared him a criminal conviction, it came with severe consequences. He lost his medical license, was barred from participating in federal healthcare programs, and faced multiple civil suits from patients who felt betrayed. The local paper's front-page headline read, "From Hero to Cautionary Tale." In the months following the settlement, the ripple effects of the case spread beyond Houston. Medical associations across Texas issued updated guidelines on ethical billing, emphasizing transparency and documentation. Insurance companies tightened their review processes, using advanced AI algorithms to flag potential fraud earlier. Former patients of Dr. Ellery found themselves dealing with insurance complications, as their medical histories now contained records of procedures they never received. Some struggled to get approvals for genuine future treatments because insurers questioned their credibility. For Ellery, the fall was both personal and financial. He sold his home, relocated to a smaller city, and avoided public appearances. Friends reported that he rarely spoke about the case, though he privately maintained that he had been a victim of overzealous regulators misinterpreting standard practices. In the healthcare community, his name became shorthand for the dangers of putting profit before patients. At conferences, compliance officers cited the Ellery case as a warning that fraud can destroy not only a career but also the trust that underpins the entire medical system. While his story faded from headlines over time, its lessons endured, a stark reminder that integrity in medicine is not just a legal requirement but a moral one. In Houston's thriving medical community, one physician had long been regarded as a model of excellence. Patients trusted him with their lives, colleagues praised his skill, and his name carried weight across hospitals and clinics. For years, his practice grew steadily, expanding services and drawing in patients from surrounding cities. On the surface, it was a picture of medical success, until quiet whispers of irregularities began to spread. The first signs were subtle. Insurance companies started flagging a curious trend: the same patients receiving multiple high-cost procedures within days, charges for services never performed, and inflated bills far beyond standard rates. What looked like an occasional billing error soon appeared as a deliberate pattern. Behind the scenes, a few employees had noticed the inconsistencies, but fear of retaliation kept them silent, until one whistleblower decided the risk of speaking out was worth it. The whistleblower, a former administrative assistant, handed over a trove of internal documents to investigators. These included falsified patient records, altered procedure codes, and even emails where staff were instructed to maximize claim value, coded language that essentially meant overbilling insurers. The documents also showed that some patients had no idea their insurance was being charged for treatments they never received. For investigators, it was the break they needed. Once federal and state authorities got involved, the scope of the fraud became clearer. Teams of forensic accountants pored over years of billing data, tracing patterns that revealed systematic exploitation of the insurance process. Undercover agents posed as patients, and in some cases, the physician's team billed for treatments these agents never underwent. The findings painted a damning picture. This was not an occasional oversight or misunderstanding. It was a well-oiled operation designed to funnel millions in illegitimate reimbursements into the practice's accounts. As evidence mounted, the legal pressure intensified. Prosecutors prepared a case that could have led to criminal charges, heavy fines, and a long prison sentence. The media caught wind of the investigation, and soon the physician's name was on every local news broadcast. Patients, many of whom had defended him initially, were shocked by the scale of the allegations. Community trust eroded rapidly, and his once busy clinic began to empty. In the end, the doctor agreed to settle the case for $2 million without admitting guilt. It was a strategic move, avoiding the risk of a trial and potential prison time, but at the cost of his career, professional reputation, and medical license. The settlement required strict compliance monitoring, ensuring he would never again be in a position to submit insurance claims. The case became a lesson for the healthcare industry. Experts pointed out that medical billing fraud not only drains insurance funds but also drives up costs for patients and damages public trust in medical institutions. Calls for stronger oversight grew louder, with proposals for more frequent audits, advanced billing software with fraud detection, and stronger protections for whistleblowers who come forward. For patients, the story was a stark reminder to regularly review their insurance statements and question charges they don't understand. For medical professionals, it reinforced the idea that integrity is as important as skill. In Houston, the scandal still serves as a cautionary tale, proof that no matter how respected someone may be, fraudulent actions can bring down even the most celebrated careers.